Dismissal of the acting chief executive officer of the Social Health Authority, Elijah Wachira, and the resignation of a board member, Dr. Zakayo Kariuki-Gichuki, who was the chairman of the Strategy and Operations Committee of the board, has now raised more questions than answers about the reality of this new health insurance. 43 days since its rollout, Kenyans have been complaining about its performance, with some forced to pay for medical services from their pockets despite paying SHA contributions. NTV senior reporter Ibrahim Karanja kicks off our broadcast tonight.
Tuesday's suspension of Dr. Elijah Wachira for a period of 90 days as investigations into his conduct are carried out is perhaps the clearest indication that the government finally acknowledges that all is not well at the social health insurer, corroborating previous stories by patients suffering from lack of medical care as captured in numerous media reports and exposés, and the reluctance by health facilities in offering services under the new scheme. While the letter by the Social Health Authority chairperson, Dr. Abdi Mohammed, did not lay out the exact reasons, sources indicated that it was due to sabotage of the transition process that was quote-unquote bungled. Sadly, though, amidst the boardroom politics allegedly aimed at streamlining the sector, fact remains that SHA is not as effective as many Kenyans would have wanted it to be, and members of parliament captured this all too well in an adjournment motion by Rangwe Member of Parliament Lilian Gogo Tuesday evening.
Private hospitals provide healthcare, Honorable Speaker. These are people you can never negotiate with. But when our people go, they are turned away. When they go to public hospitals, they are turned away. Where will the Kenyan poor, Honorable Speaker, go to?
The cries we are getting from our own constituencies, the cries we are getting from ordinary Kenyans is telling you that there is a huge problem with the transition. And this transition was not done efficiently.
Speaker, we have a problem. And the basic problem is a problem of transition. So when we actually passed these bills, remember our greatest argument was actually on the issue of transition. So what has happened and why SHA and CHIEF actually have gotten into problems is the transition, we didn't manage it well.
But even before the October 1st rollout of SHA, the pit signs were too many to ignore. From the loud pleas for more time to fine-tune the systems, a two-time postponement of the rollout date, a last-minute change of leadership, and the abrupt disenabling of the NHIF that had been in operation for decades. Private hospitals also immediately expressed reluctance to admit patients under SHA owing to huge pending bills owed to them by the defunct NHIF. Even the dodgy explanations on the yet-to-be-tried and incomplete healthcare management information system that cost 104 billion shillings did not help the situation. So big is the Social Health Authority in handling client money that it only comes second to the Kenya Revenue Authority. So much so that the collection of the mandatory 2.75% from the income of any household across the country to contribute to the scheme hurried its process, despite the process evidently being not fully ready. Arguably, SHA's most critical committee to the board level is that of Strategy and Operations, a committee whose chairperson, Dr. Zakayo Kariuki, resigned Monday, just hours before the forced temporary exit of the acting CEO. A smoking gun? While the government has in the past 43 days highlighted success stories coming from the Social Health Authority, it is also clear that the number of those who have concerns about the workings of the new social health insurance is higher than those who are speaking about its success stories. Perhaps an indicator for the Ministry of Health and the government at large to put more focus to ensure that this is not only effective but also caters for more Kenyans, as was the intention from the beginning. Ibrahim Karanja, NTV, Nairobi.